all the participants to the last session of the conference. Here, today to take over this session, we have our esteemed speaker, Mr. Ranjith Inbasekaran. He has almost 10 years of experience in renal supportive and renal therapies. Completed his bachelor's science in allied health sciences, in renal science and dialysis technology from Ramachandra University, Chennai. Completed his master's in renal science and dialysis technology from same Ramachandra University, Chennai. He is a certified hemodialysis technologist by Board of Nephrology Examiners for Nursing and Technology. He is also certified as a basic life support provider by American Heart Association and Indian Association of Pediatrics. He is also certified as Pediatric Advanced Life Support Provider by Indian Association of Pediatrics. He is a member of Society for Renal Dialysis Technologists and Paramedicals. He has worked in B.N. Patel Institute of Paramedical Sciences as a clinical instructor and dialysis technologist for more than 2 years. He has worked as a lecturer in dialysis technology in SRM University for 3 years. From 2018, working pyramid dialysis Lane as a dialysis technologist. His projects are on assay of water quality monitoring in hemodialysis room in the year 2010 and Doppler study of hemodialysis vascular access in the year 2014. He has co-authored pediatric dialysis paper and he has also authored a manual of dialysis technology. He has attended many national and international, also presented papers. With this very short introduction, we have Mr. Ranjith Inbasekaran to take over the session.
Thank you for a very nice introduction. I'd like to, it's my honor to be given this opportunity to host the webinar. And we'll be seeing about benign nephrosclerosis. And for the convenience and for better understanding, I've added few slides of malignant nephrosclerosis as well. So hypertension around the world is a global challenge, and it is increasing every year. Around 1.9 billion people around the world suffer from hypertension. Half of them are not diagnosed. In India alone, 400 million people, or that is 4 crore people, are suffering from hypertension. Most of these people suffering from hypertension develop cardiac disease, cerebrovascular disease, vascular disease, and kidney disease. And majority of the population with hypertension develop mortality due to cardiovascular disease, that is 50% of them, and 10 to 15% of them develop mortality due to cerebrovascular conditions, and around 10% of them develop kidney disease. Even though it's 10% might look small, it is very significant, and it is very important to understand. And hypertensive nephropathy presents as a benign or a malignant nephrosclerosis due to chronic hypertension. As we can see here, benign nephrosclerosis accounts for 4.1% of etiology of chronic renal disease in India. Nephrosclerosis can be classified into benign and malignant nephrosclerosis. Benign is a very less harmful form of nephrosclerosis, in which many of the patients with such condition may go undiagnosed during their entire lifespan. However, malignant nephrosclerosis is very dangerous, and most of them develop end-stage renal disease. Benign nephrosclerosis is associated with mild to moderate chronic hypertension, in which patient will develop hyaline deposition in the arteries, and it also leads to thickening of the vessel wall. And when the vessel wall becomes thick, it leads to poor blood flow to the glomerulus and leads to ischemia, and then which in turn leads to glomerular sclerosis and tubular atrophy. Pathophysiology of benign nephrosclerosis involves uh, vascular, glomerular, and tubular and interstitial changes. Vascular changes includes the intimal fibrosis and medial thickening due to the compensatory mechanism, and then hyaline deposition in the afferent arterioles due to the endothelial damage and incident of the plasma macromolecules into the causing hyaline deposition. And all of the three conditions leads to luminal narrowing, and which in turn will lead to the poor flow of blood vessel to the glomerulus and leads to ischemia. And ischemic injury leads to nephron loss, which can present as sclerosis, and it also may lead to some conditions, some patients with the focal segmental sclerosis as a compensatory response to glomerular enlargement due to the some glomerulus is lost. And the last one is the interstitial and tubular changes. Interstitial and tubular changes are incompletely understood. Um, it is most of the time associated with the fibrosis of interstitium and the tubular atrophy. The kidneys might appear normal in most cases, and in some the size will be reduced. The size of the kidneys usually varies due to the longevity of the hypertension and the severity of the hypertension. There will be presence of granularity that resembles as grainy leathery appearance, and loss of masses due to the cortical scarring and shrinking. We'll be seeing in the next image. Here we can see the granular appearance in the kidney. A lot of granules are there, and between the granules we can see the grooves. The granules represents the normal tissue, and the area where there are grooves are the area there are scars. Renal scarring is there, cortical scarring, and these are all the areas with impaired nephrons. Here we can see the leathery appearance of the kidney, and in this right side image we can see the granular image and the normal kidney in the right side. This small hole is not because of benign nephrosclerosis. It's because of simple cyst. In the left image, we can see enlarged due to the intimal and medial thickening. This image represents the hyaline arteriosclerosis, and here we can see this is the groove and this is the granular area in the cortex. Here we can see the damaged tissues. Here we can see the completely lost glomerulus with the Bowman space replaced with hyaline, that is fibrosis of the complete tissue. And here we can see the normal glomerulus and the tubules as well. Here also the tubules are normal. Um, uh, this is what leads to the uh, appearance of the kidney, grainy appearance of the kidney. Here we can see in the left side we can see the glomerulus, which is mildly shrunken, and in the middle we can see the Bowman's capsule is completely replaced with collagen. This is another image which shows a lot of glomerulus completely collapsed, and the Bowman space is replaced with fibrosis. In this image, we can see the glomerulus has started shrinking here, and then the vascular pole of the glomerulus in the Bowman space, we can see the fibrosis that is filling with collagen. This is the normal glomerulus. Here again, there is a loss of glomeruli. The glomeruli started collapsing, and then the common spaces started filling with collagen. This is an image of uh, biopsy specimen of a patient with hypertension and proteinuria, which shows the global loss of glomerulus and tubular atrophy. This is an image of a focal segmental glomerular sclerosis and loss of some tubules here. The clinical manifestation includes hypertension, proteinuria, uricemia, and renal failure. Uh, Most of the patients with benign nephrosclerosis may not develop such symptoms. It might go unnoticed during their entire duration of life. Treatment, when detected, should be treated with antihypertensive drugs and control of blood pressure measures such as lifestyle modification. Malignant nephrosclerosis, on the other hand, is very dangerous, and in most cases, it will lead to chronic renal failure and end-stage renal disease. The renal involvement in malignant hypertension is what is called as malignant nephrosclerosis. Pathophysiology is due to the vascular injury when there is a mild to moderate elevation of blood pressure. As a compensatory measure, arterial vasoconstriction will be there. When there is a vasoconstriction, the renin-angiotensin system will get activated and further leads to severe hypertension. And then autoregulation will fail, which in turn will lead to rise in arteriolar and capillary pressure, and then it will lead to damage to the vascular wall. Kidney size depends on the duration and severity of the hypertensive disease. Most of the patients will have smaller kidneys. There will be a presence of small pinpoint petechial hemorrhages, which may look like a flea-bitten appearance. We'll see in the next slide. And in some occasions, there will be presence of infarct in some areas. Unfortunately, I couldn't find the image with the infarction. Here is the image with the flea-bitten appearance of the kidney. Here we can see the entire area of corticomedullary differentiation is present with the hemorrhage. Here we can see the fibronecrosis of the apparent arteriole, and in this right side image we can see the onion skin lesion due to the intimal fibrosis. And this image shows in the right side we can see the abnormal glomerulus, and left side we can see the normal glomerulus. In the right side, the image represents the thrombotic microangiopathy. And here we can see the onion skin lesion. This image represents the presence of collapsing glomerulus, and mesangium is lysed, and then there is presence of thrombotic changes in the glomerulus. This is the normal glomerulus. Clinical manifestation includes retinal hemorrhage, intracerebral and subarachnoid bleeding, seizures, coma, kidney injury, hematuria, proteinuria, fibrinal necrosis, headache, nausea, and vomiting. And all those patients with malignant hypertension and malignant nephrosclerosis has very poor prognosis even with the treatment. However, without treatment, the mortality rate is very high. Treatment for malignant hypertension is benign malignant nephrosclerosis by using the antihypertensive drugs, by using nitroprusside, nicardipine, clavidipine, labetalol, and phenodipine. And oral antihypertensive drugs also can be given, nifedipine and captopril. That's all. Thank you. Uh, on a lighter note, I would like to uh, request all of the young minds that we have a huge potential to reach great heights. Nowadays, I've seen a lot of people are spending too much time in their smartphone. I believe that this the addiction to smartphone can lead to decreased memory and creativity. Uh, hello, hello. Yeah, yeah. Um, so I would suggest that we should spend more time in good things instead of spending a lot of time in the smartphones. I'd like to know if you have any questions.
Ranjit sir,
Yeah, hi.
thank you sir. It was a very informative session.
Sorry, I made it very short actually. The given time was 1.5 hours, and then I made it very short.
Thank you for joining us today, sir.
Right.
Participants, if you have any queries or clarifications, you can post it in the chat box. Participants, if you have any queries or clarifications, you can post it in the chat box. Somebody has asked. So somebody has asked, for hypertension, should they use ACE only?
No, they can use AC inhibitors, ARBS also, but in patients with renal disease, this AC inhibitors and ARBS are shown to prevent renal damage. That's why I mentioned particularly ACs and ARBS.
One has asked about the smartphone, sir.
Yeah.
Smartphone, which may be the reason for hypertension.
Maybe it can cause, but I haven't come across any studies which shows smartphone leading to hypertension. But there are a lot of articles which shows that it can lead to multiple adverse effects due to um, prolonged usage of smartphones, um, especially related to cognitive impairment and decreased attention span and multiple other learning difficulties.
Participants, any more queries, you can post it in the chat box. So one has asked how to prevent hypertension in young age.
Um, Hypertension can be prevented by regular exercise and leading a healthy life, uh, uh, eating habits, and um, apart from that, um, sedentary life can lead to hypertension in young age in most people. So, if we keep ourselves active, we can prevent hypertension.
So one has asked how to manage and how to prevent neonatal case.
Uh, Only the management of hypertension in neonatal cases will be the main difference will be same as in adult. That only the dosage of antihypertensive drugs will be different for pediatric. I mean neonatal and pediatric cases. And this both the benign and malignant nephrosclerosis is seen in adult patients, not in neonatal cases.
Participants, any other queries? You can post them in the chat box. Ranjit sir, I don't find any other queries.
All right.
Yes, sir. Thank you very
Uh,
much for accepting our invite and joining with us today, sir.
Thank you for giving me this opportunity. Actually, it's been pleasure taking this chance to interact with you and take this class. And I hope we'll have uh, op- opportunity to take another webinar on some other topic.
Sure, sir. Sir, one last query, I guess. How will you
Yeah.
manage hypertension in CKD patients?
CKD patients, the hypertension is secondary hypertension. It's not most of the patients with CKD develop secondary hypertension. We classify hypertension into primary and secondary, and the hypertension in CKD is secondary hypertension. So it's managed by various methods, and if the patient's on dialysis, managing the fluid will help us in treating the hypertension. And apart from that, antihypertensive drugs.
One
The
more, sir.
most yeah,
Yeah, yeah. You can continue, sir. You can continue.
the most important method of management of hypertension in patients with ESRD on dialysis is by removing adequate fluid from them when their kidneys are not able to remove sufficient fluid.
One more, sir. How can we prevent renal failure due to hypertension?
We must identify and treat hypertension early so that it will not lead to um, uh, renal disease. The best way is to combine antihypertensive drugs along with lifestyle modification. Here, the key method is to identify early, treat hypertension by using antihypertensive as well as lifestyle modification.
Next one is chances of ischemia caused due to hypertension.
Uh, there are no exact statistics available for chances of ischemia caused due to um, uh, hypertension. This is the pathophysiology of causing um, benign and malignant nephrosclerosis.
One other one is asked, how does high BP increase GFR?
High blood flow to the glomerulus, essentially all returned into the Bowman space. That this increase rate actually. Eventually, this is what will lead to damage to the glomerulus as well. Someone asked how to treat,
How to prevent this?
prevent and treat hypertension in post-renal transplant patient. It is same as the um, not having transplant. The prevention and management is same as the normal adults. Though it is same, it is very important to prevent and treat hypertension in post-transplant patient because those patients might develop renal failure again due to hypertension. It is very important to monitor the blood pressure and treat hypertension at the earliest.
Thank you, sir. How can we prevent renal failure due to hypertension? I
Uh,
think already someone has asked about this.
yeah, that's right. Still, it is by um, regulating the blood pressure, that is by giving antihypertensive drugs as well as by lifestyle modification and early identification of hypertension and treating it at the earliest will prevent damage to the kidneys.
Shall we end the session? Ranjit sir?
Yeah,
Thank you, sir. Shall we end the session now, sir?
yeah, sure.
Thank you, sir. Thank you so much, sir.
Thank you so much.
Sir, one has asked something, sir.
Yeah,
Drugs can be used in surgical hypertension.
surgical hypertension. The treatment will be the same. Any hypertension will be needing to give. I think you mentioned about uh, emergency hypertensive crisis, which will be giving, um, which we will be need to give IV antihypertensive drugs such as hydralazine.
Yes, sir. Okay, sir. Thank you so much, sir.
Thank you.
Participants, I'm posting the feedback link on the chat box. all the participants, please click on the link and give your feedback. Now, we are moving to the last part of the conference, which is vote of thanks. First and foremost, I thank our Dean, Dr. B. Sendal Kumar, for giving us this opportunity and supporting us throughout this conference. Next, I thank all our distinguished speakers who came up for the conference, who readily accepted our invite and gave us a very valuable lecture. Next, I would like to thank my organizing team members, Mrs. Rani, Anita, Mrs. Ranjita, Mr. Kadiresan, Dr. Vaishnava Devi, Dr. Jiggy, Dr. Dhanasegaran, Mr. Satish Kumar, Mr. Muturaj, for organizing this wonderful conference on basic medical sciences. I also wanted to thank Mrs. Thamil Chudar and Dr. Harish Raj for helping me out technically for this conference. Last but not the least, I thank all the participants for patiently listening to all the lectures. Thank you all the participants. A small information about the certificate, conference certificate. Participants who have done their payment along with the registration will receive a quiz link by tomorrow. I request those who receive that link to click on the link and finish off the quiz, after which you'll be receiving a certificate. I repeat, participants who have done their payment along with registrations and also completed all the feedbacks right from the first day till now will receive a link, a quiz link in their mail. I request those participants to click on the link and complete the quiz, after which you'll be receiving a certificate for this conference. சார் ரைட் கிளிக் பண்ணா ஹோஸ்ட்டை மாத்திக்கலான்னு கேட்குது. எக்ஸ்பெல் கொடுத்துட்டா அவங்க தான் போகணும்.